and welcome to the very first episode of On Your Way Out. Today we have a very special guest with us. We have Dr. Moyer. He is an oral and maxillofacial surgeon. He's been practicing for about 30 years in Portland. For those of you who went to Temple, he did his DDS at Temple, and then he went on to do his oral surgery residency at Nebraska. So we're very lucky to have him at the UNE Oral Health Center helping us out. So thank you so much for being here, Dr. Moyer.
You're welcome.
Really appreciate it.
Mm-hmm.
So as you probably guessed, our topic for today is oral surgery for a general dentist. So I will go ahead and just jump in. My first question for Dr. Moyer today is, picture this. You've just graduated dental school, you started working, you've done a ton of extractions in dental school, however, you still find yourself stuck in a really challenging case. So what are some of the things that you would recommend for a new grad to do? What kind of instruments would you recommend for them to reach out and try out?
Good question, Yalda. The first thing you have to do when you get into trouble, because you're typically nervous, is to slow down. Will Rogers is a great comedian and cowboy who I like to quote to the students. And he said, the first thing you do when you find yourself in a hole is stop digging, which means that you just need to reassess. And if you're having problems with an extraction, I would recommend that you just take a step back, perhaps reassess the x-ray to ensure that you've understood the anatomy of the roots and any surrounding structures. And then typically elevators are underused. People want to go directly to forceps, and I would try to elevate the tooth a little bit more, try to get some movement. And I often tell the students to be the tooth, and that is take what it will give you. If it's moving distally, try to move the tooth distally. Typically, lower molars will want to go buccally in their final movement out of the socket, but be the tooth and have it move in the way you want it to move. Also, get a good purchase on the tooth. If you're having trouble moving the tooth, the forceps, once the tooth is purchased and held onto by the forceps, the forceps can't rock on the tooth. It can't slide. They have to be held in place. So you have to find the right balance of pressure and then force to remove it. And then typically a problem that you could occur is root tips, and leaving root tips behind is always worrisome. So primarily, if you've got the tooth loose enough, I was in the clinic today, and unfortunately a student had the tooth loose enough that the root tip was able to be suctioned out. If not, your root tip picks are the key, or I use a set of small instruments called periotomes, and you can get them from your local dental supplier, but they make a spade periotome that is very, very good at removing root tips. And then my favorite instrument to use, and it's primarily used for upper third molars, is a Potts elevator. I tell the students that it's rarely used. I don't see it used a lot in other schools, but POTTS, easy to see. They're left and right-handed, and primarily they're used for taking out upper third molars that are partially erupted or even fully erupted. So a Potts elevator is something I think if you have in your armamentarium, it would be good to use if you're in trouble.
Perfect. I recall a time working with you and you said, let's grab the Potts. So that's perfect. Thanks for bringing those. So moving on, I have another question for you, Dr. Moyer. So let's say a patient comes to your office, you've never seen this patient before, and you take a look and you realize they need full mouth extraction for whatever reason. What are some things that you would recommend the dentist kind of looks out for before they decide to accept this case?
Well, full mouth tooth extraction for a general dentist, first of all, requires time, and you have to be confident in your ability to extract numerous teeth. And typically when you're extracting numerous teeth, you may need to do some suturing. So you need to be confident in your abilities with multiple extractions. And then the first thing, as any good practitioner would do, would be to evaluate your patient. Make sure they're suitable for a prolonged procedure, that they can hold their mouth open for some time, that their medical history does not preclude any problems with bleeding, or they won't fatigue quickly. Once you've assessed that all those things are in order, and then undertaking a full mouth tooth extraction, you want to look at the things that you look at really for any extraction. You want to assess the location of the inferior alveolar nerve, whether the maxillary molars, first and second molars, are close to the maxillary sinus, so that you can anticipate a sinus opening or an oral antral opening and warn your patient about it, or at least give them a good informed consent. I also get a little bit worried about maxillary posterior molars that are freestanding. A freestanding second molar that's occluding against a lower molar oftentimes is used for chewing and will be difficult to extract. And I've also, unfortunately, removed the tuberosity in removing that tooth. So be aware that a freestanding upper third or second molar, first molar may be more difficult to remove, and you may jeopardize the maxillary tuberosity. One of the questions I also ask, and before I get started, is how their extractions, if they've had any extractions before, how those extractions went. I'm not have an ego, but my ego is not so large that I wouldn't understand if they had trouble with another surgeon taking teeth out. I may have trouble myself and want to plan accordingly. So to summarize, a full mouth tooth extraction will take time, and your patient has to be able to tolerate that time. And I understand as a new practitioner, you may want to dive into something like that. Your schedule may not be full, and you want to kind of get going, so you accept that. Be aware of your own limitations when you tackle a big case like that.
Okay, perfect. Thanks for that. So my last question is, so obviously we all want to be the hero, we all want to alleviate our patient's pain, but when should a general dentist really sit back and say, I'm going to send you to an oral surgeon, I'm going to refer this out? What are some of the things that we should look for before doing that?
Yeah, I think this is one of the most important questions for a new grad. And I kind of alluded to it in my last answer. I just asked a colleague of mine what he refers out, and he practiced with me for 30 years. We practiced together, and he now teaches at the school. And he told me that he thought that anything that was beyond his comfort zone, and specifically teeth that were decayed to the gum line where he knew he'd have to raise a flap and perhaps use a surgical handpiece. And I would caution you against using your high-speed handpiece dissection to teeth. You really need a low-speed, high-torque surgical handpiece dissection teeth, or you can cause air emphysema and other untoward effects. So he said teeth that were decayed to the gum line, teeth with dilacerated roots. He was particularly worried about upper first and second molars that had roots into the sinuses. He also said that a PDL space that looked very narrow, or the tooth appeared to be ankylosed, he would refer out. You have to understand that if you start to tackle an extraction that then turns into something more difficult, your schedule for the day will be off, your patient will not be happy with you if you have to refer it out, and it really becomes a problem for you. So I'm not trying to scare you, but I'm trying to tell you to use a little common sense and maybe err on the side of being conservative, and then take an easier tooth out, a periodontally involved tooth that perhaps has very straightforward roots, conical roots, or snow cone roots as I call them. And you can have those, take that out and gain some experience with that if you don't have a lot of extraction experience. The other thing to do also is, one of the things that I would see a patient from a general practitioner's office would be bleeding post-operatively. And you have to assess that medical history and make sure that they don't have a bleeding problem. And one of the questions I ask a patient is, have they had any bleeding problems after they've had a tooth out? It's two questions. How did the extraction go? Was it easy? Was it difficult? And then did they have any complications afterwards, like bleeding or untoward swelling? And you can get an idea of how a patient might react to the extraction that you're planning.
Perfect. Thank you so much. Well, Dr. Moyer, we are so lucky to have you. Dr. Moyer has a wealth of knowledge, tons of experience, so we're blessed to have him here with us today. Last but not least, Dr. Moyer, do you have any last words for the class of 2020 before we're on our way out?
Well, Yolda, I want to thank you for allowing me to talk
My pleasure.
to your audience. And I'm a quote guy. I have two quotes that I'd like to give to the graduating students and new in your career. And that is one from Louis Pasteur that says, "Chance favors the prepared mind." And to me, that means if you're prepared for a procedure that you're going to do, or prepared for your patient, and you need a little luck on your side, you'll get that luck. The second thing has to do with patient management, and that is you never get a second chance to make a first impression. So unfortunately, your patients will judge you on how you look, how you conduct yourself, and if you're working for somebody else, your employer will judge you on the neatness of your work area, if you're on time for work. So those are things that really make a difference. You never get a second chance to make a first impression.
Awesome. Well, thank you so much, Dr. Moyer.
Thank you,
Really
Yolda.
appreciate it.
Mhm.
Thanks.